Right. Good evening, everybody. My name is Marian Matke. I am the Program Education Manager within the Division of General Internal Medicine at the Brigham and Women's Hospital. And I am in that role the administrator for the Program in Clinical Effectiveness. And the session is focused on the non-degree Program in Clinical Effectiveness. And we're glad that you've joined us tonight. With me, I have a bunch of faculty and students, and I think I'm just gonna hand it over. And my team member, Melissa, who's with me, Melissa Crocker's with me on the admin team. Um, I'm gonna hand it over to Heather to say hello and have everybody do their little introductions.
Sure. Thanks, Marian. Hi, everybody. Nice to see you. Thanks for joining us this evening or whatever time it is where you are. I'm Heather Baer. I am, what am I? I am an epidemiologist by training, but I am also an associate professor, and my research is based in the Division of General Internal Medicine and Primary Care at the Brigham, but I spend a lot of time doing kind of teaching and educational work at the Harvard T.H. Chan School of Public Health, and I co-teach Introduction to Clinical Epidemiology, which is one of the courses that are part of the PCE. So that's me. Should I pass it to somebody else, Marian? Maybe I'll turn it to Brian for a minute. Brian, why don't you go ahead and introduce yourself?
Okay, I'm Brian Healy. I'm a biostatistician, and I will teach the introductory biostatistics course that is immediately after Heather's course in the morning. And I've been teaching at the T.H. Chan School for about 15 years.
Okay, I guess it's my turn now. I'm Fran Cook. I'm one of the co-directors of the program in clinical effectiveness. I'm also an epidemiologist. I also give some lectures in the introductory epidemiology course in the program. But I'll be driving the bus tonight. I'll be showing some slides, and Heather will comment, Brian will comment, maybe some of our other faculty might be joining us to comment. And then after we show the slides, we'll open up to any questions that you might have. So let me start by sharing my screen. Hopefully this thing will work correctly. Share. And I'm asking, Marian, do you see my slides in full view?
I do see your slides in full view.
Okay, so let's first of all, welcome. I'm out in Portland, Oregon right now, so it's still the afternoon for me. Some of you might be on the East Coast, so it's evening time. There may well be people who are here from around the world, and if anybody's here in the middle of the night, I appreciate you joining us. As Marian said, this is recorded, so you can be able to see everything we say again if you want. But thanks everybody for coming. I anticipate there'll be a few more maybe joining us as we go along. Let's click on this and see if I can advance the slide. Boom, here we go. Here's the agenda. First, I'm going to give you a brief description and a history of the program in clinical effectiveness. I'm going to spend a little bit of time talking about the courses we offer. Then I'm going to show you some results of a survey we did on our 20th anniversary. That was a long time ago. Then we'll talk about some degree programs that were developed at the School of Public Health for any of you who want to go on for a degree in the future. And I'll spend some time talking about that. Then we have the good fortune of having a few of our PC grads here, and hopefully they will give us very open, honest appraisals of this program. And then I'll end up with my big slide for why you might want to enroll in the program in clinical effectiveness. Then we'll open it up for questions. As far as the description and the history of the program, basically, what is the program in clinical effectiveness? It's a very intensive, a 6-week program designed for physicians and other clinicians who want the quantitative skills needed to do clinical research or health services research or population-based research. So we're here to train you with the skills you need to do clinical research. I said it's intensive because there are 3 classes everyone takes every day. In addition to that, there's some computer labs, there's some office hours. So it's pretty much, you know, almost 9 to 5 for 5 days a week for 6 weeks. It's a very intensive program. The good news is that after you complete this program, you gain 15 credits that you can now talk about this. You can apply towards a future degree at Harvard if you want to. It's essentially completed 1/3 of the credits needed to get a master's of public health. at the School of Public Health, or a little bit more than 1/3 of the credits you need to get a Master's of Science. There are two groups of students taking the program in clinical effectiveness every year. There are people like yourselves who are taking this as a standalone, non-degree certificate program. At the end of the 15 credits, at the end of the 6 weeks, you'll get a certificate of attendance into this program. But there are also students who have already applied to the School of Public Health. The application process is going on now. The applications are being reviewed, and they will begin their MPH or their Masters of Science with the 15 credits offered by the program in clinical effectiveness. So those are the two students that we have, and there's no difference in their backgrounds at all, except one is starting a degree program and one is in a certificate program and maybe in a degree program in the future. In terms of the history, we've been doing this for 37 years. We started doing this in 1987. And so when you compare this to other certificate programs that might offer the skills needed to do clinical research, we are the granddaddy of them. We're the ones, probably the first one to do this. Many of the other programs are very good, but they don't have the track record, I think, that we've had 37 years of experience teaching this summer program. We've had about 4,000 students take the program so far. And about 2,000 of them, about half of them come back for a second summer as part of a degree program that they pursue at the Harvard School of Public Health. Over the years, we've modified the curriculum for the core courses that we'll talk about in a minute. We've added new elective courses in the afternoon over the years. We'll talk about those in a few minutes also. As I mentioned, we've developed degree programs at the Harvard Chan School of Public Health that are targeted for graduates of the program in clinical effectiveness. And I'll just briefly mention those later. And we even developed a field of study within the MPH program at the Harvard Chan School of Public Health that is specific for people who take the program in clinical effectiveness. And in the past, I don't know if this is true now, it has been the largest of the various fields of studies in the MPH program. So let's talk about the courses. And what I really want to stress is the morning. This is the guts of the program. This is what I think makes us special. We offer in the morning, it's dedicated to epidemiology and biostatistics. We offer 2 courses, or 3 courses actually. Everyone takes a summer-long course in epidemiology, Epi 208, which is taught by Heather. Heather will talk about it in a few minutes. And everyone takes a sequence of 2 courses. Biostatistics 206 and 207, which are taught by Brian. He'll talk about those in a minute. So basically what the summer looks at, I should say before I show you the schedule, these are very, very, very highly rated courses. I believe there are 1, 2, 3, 4, 5 different sequences of introductory epidemiology and biostatistics courses offered at the School of Public Health at Harvard. This is by far, in my opinion, the best one for those people who want to go on and develop the skills needed to do clinical research. And I think when Heather and Brian talk about their courses, you'll see what is different about those courses than other courses. I'll make a couple of comments then also. They're very applied in their nature. They are integrated, these 2 courses. So since the same students are taking both courses, the faculty can build off of that. We know what's being taught in the biostatistics course when we give our epidemiology lectures, and vice versa. In my view, they are the flagship courses of this program. And this is what it looks like in terms of a schedule. All morning, you'll be taking epidemiology and biostatistics in 3 90-minute periods. At 8 o'clock to 9:30, everyone's taking introductory epidemiology with Heather. At 11:30 to 1, everyone's taking biostatistics with Brian. There might be a couple of days when things are different, but that's the usual plan. And in the middle, in the 90-minute class that goes from 9:45 to 11:15, there's either a second class or exercise using epidemiology or a second class or exercise using biostatistics. So this is the morning, this is the guts, this is the flagship portion of our program. So what I'd like to do is let Heather say a few words about her course, Epidemiology 208. So Heather, can you unmute yourself and take over?
Yeah, sure. Thanks, Fran. And just to say, I like how Fran is always like, Heather's course, and like Heather is teaching this course every day. And I just want to emphasize that what makes this course really great is that it's co-taught. So even though I am the course director, I lead the course, I do teach, quite a few of the classes. I think what makes this course really excellent is that there's several other lead faculty involved, including Fran Cook, who is, talking to you right now, and then a couple other faculty who help lead. And then we have something like 60 other faculty, which sounds like a lot. But the reason for that is that there's a lot of small group activities like workshops and things, and we have a lot of other faculty who assist with those so that students can be in really small groups and get a lot of individual feedback. So just to say, I certainly am not the only teacher of EPI 208. But just to tell you what's on the slide, EPI 208, which is Introduction to Clinical Epidemiology, covers the principles and methods that are used in both traditional and clinical epidemiologic research. So we cover a lot of the topics that you would get in most intro EPI classes. So things like all the different study designs that you might use, how do you measure certain outcomes, sources of confounding and bias, and how do you account for those in your study design and your analysis. But then we also go into some what I'll call sort of special or more advanced topics that are very, I think, specific to clinical epidemiology. So things like diagnostic testing and screening, propensity scores, et cetera. So you get all of the basics that you would get in most intro EPI classes, but also go into some more specific topics that relate to clinical epidemiology. The way the course is structured is that pretty much every weekday during the time slots that Fran mentioned, we have lectures on a particular topic. And then we also have interactive class activities that are built into most of the lectures. So we do things like polling students, lots of sort of question answers. So things to try to keep things lively. There are also homeworks built in. There is a brief quiz kind of in the middle of the course to help people review and kind of sum up what they've learned so far. But I think in addition to that, again, what makes the course so special is that in addition to learning through the lectures and the in-class activities, students throughout the summer work on an individual project on a topic of their choice. And usually this is a project that students are actually intending to do, hopefully in the near future. Sometimes they do that as part of their MPH. Sometimes they're planning to write a grant to get funding. So hopefully this is something that people are actually like really trying to develop at the time that they're taking the course. And the goal of the project is to take what you're learning in class, but then apply it to an actual study that you're designing yourself. So the way the project works is that it's written up at the end of the course as a proposal for a study. So almost like a mini grant proposal written as like an 8-page double-spaced paper. But what's really nice is to get students toward that throughout the summer. We have a lot of small group workshops that are kind of built into EPI 208, again, to break people up into small groups of 3 or 4 students per faculty member to really get into depth in terms of discussing their project. There's also a presentation several weeks into the summer where students do a more formal presentation with about 10 students and 1 faculty member. There's lots of opportunities to sign up for individual office hours with faculty to get kind of consultations on the project. And then all of that culminates in the final paper. So many students really do end up using that proposal that's developed during EPI 208 and all the feedback that they get along the way to launch their research in the future. So I really think it's a great course. I talked longer than I intended, but I'm happy to, I'll stop here, but happy to answer more questions about it afterwards.
Great, thank you. And as I say, the morning is a combination of epidemiology and biostatistics. So Brian, you want to say a few words about your 2 courses that go back to back?
Sure. So BIOS or BST 206, 207, they really don't need to be 2 classes, but that's just kind of how it is. We're going to probably make them 1 class eventually because it's pretty much the same concept throughout, which is there will be a lecture to teach a topic, and then there is teaching you how to do it in the software. Because at the end of the day, my feeling about teaching statistics is the most important thing is to understand the concepts, but also to be able to do it yourself. So everything that we learn, we focus on both kind of learning the topic as well as doing it in the software. And then the other thing we really try to do is review and show connections between stuff. So there's a list of the topics we're going to do on the slide. So we'll do kind of traditional statistics all the way through regression. So if you've ever taken a statistics class before, great. A lot of the stuff you'll have heard before, but hopefully it'll become more clear when I talk about it. But if you haven't, that's absolutely fine too. We assume no prior knowledge and no previous knowledge of statistical software. We'll kind of take you from wherever you are and hopefully bring you to a better place. We do have an integrated computer exercise with EP208, and kind of throughout the class, I'll try to make sure that when I know Heather and or Fran and or any of the other faculty who are talking about things, we'll kind of make sure that we connect them to how these things are done in the software. Because again, most people who are taking this course want to be able to do some of this as well. So I think statistics is the best. So I'm super excited to get to teach anybody. And if any of the students will verify that I legitimately do think statistics is the best. And so it'll be wonderful to get to speak to you over the summer. So thank you.
Great, thanks. And if I could just, reiterate something you said in the software. Historically, we used to use SAS because that was the software package used in the Harvard teaching hospitals. Then Stata became more common. And then R became a little bit common, but he said R is going to be the future because it's free. Well, maybe now R is the present. So one of the benefits of taking Brian's class is you can learn the basics of all three of these because, if you take other courses at Harvard, some might use R, some might use Stata, some might use SAS, but you'll have the ability to learn the fundamentals of all three of them in this class. So
we'd only expect you to learn one, but we will provide you the materials for all three.
Yeah.
So then it's not like you'd have to learn all three, but if you want to, you'll have all the materials available to you. Thank you for bringing it up, Fran.
So that's the morning. And then in addition to that, every student in the program in clinical effectiveness has to take an afternoon elective course. Lunch is from 1 to 2 o'clock. At 2 o'clock or later in the afternoon, there are a series of courses that you can take in the first half of the summer 1 period, and other courses you can take in the summer 2 period. So these are roughly 3 weeks long. These are the courses that we anticipate we'll be offering in the summer 1 period for the program in clinical effectiveness students. There's a course on medical informatics. There's a course on implementation research in healthcare. There's a course on decision analysis. There's a new course taught by the team from Ariane Labs, which are talking about improvement by design, using design thinking to better innovate and improve healthcare. This is a working title. It's a new course that's being developed. It's going to be using mixed methods, quantitative, qualitative methods to look at innovations in healthcare systems. Then we've arranged for one of the courses from another summer program to move into the afternoon slot, and that'll be a course in economics for health policy research. So those are the courses that you can choose from as an elective to take in your first half of the summer. In the second half of the summer, there's a course on improving healthcare quality, research design on large databases, meaning publicly available databases. We have a pharmacoepidemiology course talking about using research with longitudinal healthcare databases. We have a machine learning course, and we have a course on regression that combines both linear and longitudinal analysis. So those are the afternoon courses that we offer. All our courses are described on our course website if you want to learn more about the details. If you take our program in clinical effectiveness, we'll hold another session later in the spring where we describe these courses in detail. But I'm just going to mention today as the courses that you can choose from in your first half of the summer and the second half of the summer. Before I go on, I'm just curious, is Dave Bates with us? Okay, because he's another co-director in this program and teaches one of these electives. So that's the curriculum for the program in clinical effectiveness. We also offer courses for the returning students coming back for the second summer. Remember, I said about half of our enrollees come back as part of a degree program their second summer. We offer an advanced, in the summer 1 period, a 5-credit, meaning weeks twice each morning, course on epidemiologic methods for clinical research. It has a terrible title, Analytical Aspects of Clinical Epidemiology. I take the blame for that, but basically it's epi methods using regression models to either control confounding, build and validate prediction rules, or to build propensity scores to control for confounding. And then the second period of the summer, we offer another course on survival analysis methods for clinical research, Cox regression. So Brian mentioned he gets to regression at the end of his course for the first year students. Returning students can use the EPI 236 and apply logistic regression models. They can use Biostat 224 and learn how to use Cox regression models for survival analysis. And as I mentioned, we have an afternoon course that talks about linear regression and longitudinal analysis. So we have a good coverage of the common regression methods used for doing clinical research. So those are the courses we offer. And just to say a few words, especially about the morning course that Heather and others teach. We did a survey back in 2006, 2007 for our 20th anniversary of the program. It started in 1987. At that time, we had almost 1,500 graduates of the program in clinical effectiveness. Now we have about 4,000. We're able to contact and get responses from 3/4, 73% of those people. And on our website, you can get a copy of that particular publication if you want to read it. There are some other publications that describe our program. But I just want to note a couple of findings that we got from this survey. First of all, we asked people, what are they doing at that time? Now, for some people, it had been 20 years since they took the program in clinical effectiveness. For others, it had been 1 year. But I was surprised that 6 of our graduates were deans at medical institutions, medical schools. 31 were department chairs, et cetera, et cetera. This shows the type of positions that our graduates go on to. We might repeat this survey at our 40th anniversary, then many more years have passed between when students took the program in clinical effectiveness and now. So I suspect we'd even see more higher level positions. Now, we can take some credit for this, but I think that also reflects the type of students that we have enrolled in this program. We're very fortunate to have, I think, a gifted audience of students, and we try to have them work together. I'm a big believer in peer education, building networks among our students. I think they'll learn just as much from fellow students as they will learn from our faculty. The other thing I want to point out from this survey is we asked students about the projects they did. Heather described the project that everyone does in the morning epidemiology course. 69% of the 64% of the people in that survey said the project they designed in the epidemiology course led to a publication. And 43% of them said that design project that they did in EPI 208 actually led to a successful grant application. They got funding to do that project. I mentioned our program is very applied. We ask the same things about afternoon courses. Many of our afternoon courses have students working in small groups to do projects. 30% of them, of these survey responders, said that the project they did in the afternoon class led to a publication, and 14% said they got grant funding for doing it. So I think this makes our program special, the applied nature that we give you the tools to do clinical research in a way that you can hit the ground running after our program ends. So that's what I wanted to say about our program. I mentioned that some of the students taking the program this year will be starting degree programs. Others are in our certificate program. Many people in the certificate program in the future decide they want more and want to apply to Harvard, Chan for future, courses and leading to a degree. And we've developed a few targeted degree programs that are specific for the graduates of the program in clinical effectiveness. First of all, I want to make the point is that all the tuition you pay for in the program in clinical effectiveness and all the credits you earn can be rolled over into a future degree program if you are accepted into one. Meaning our tuition is high because we charge the same, the cost of taking the program in clinical effectiveness is linked to the cost that Harvard charges for taking courses in degree programs. You pay the same tuition for taking our courses in the summer as the degree students pay for taking our courses. But I just want to stress that if you do go on for a degree, you can roll over all those credits and tuition if you are successfully accepted. And our acceptance rate is extremely high. So that's one of the things to realize about the certificate program. It's not meant to be a feeder program for degree programs. It's meant to be a standalone certificate program to give you these skills. But we try our best to help you go to the next step if you want to do that. As I said, the targeted programs, we've developed a field of study in the MPH program called MPH CLE for clinical effectiveness. We have an academic year scheduled to doing. We have a summer focus where you can complete this with just taking summer courses and some online courses during the year, not having to be at Harvard in the fall and the spring semester. We also have a summer-only schedule leading to a Master's of Science in Epidemiology. And you can learn more about those programs if you want by checking the School of Public Health webpage. Okay, there's much more on our own webpage that I'm not going to go through tonight. These are just the various things that you could learn about. Pour yourself a glass of wine or a cup of tea sometime and just surf our webpage to see what we offer, what other graduates think of our program, etc. So that's what I wanted to say about the program, but I'm going to turn it over to Heather because she successfully recruited some of our graduates to hopefully give us a very candid, honest appraisal of the program. Heather, so can you take over?
Sure, but I'm going to turn it over to our students in just a minute. So, I mean, I think actually anytime that I recruit past PCE students or, current MPH students or both for these sessions, I always get many responses immediately because our students are so amazing and I feel like they love to talk about our program. So it's actually really not hard at all to find students. But that said, I am grateful that we have, I think we were supposed to have 3, but I don't see Anvesh on right now. I do see Shai and Sarah. So I'm going to turn it over to them in just a minute. So I'm going to ask Shai and then Sarah to just say hello, introduce themselves very briefly, say a little bit about what they do professionally, and maybe either why they chose the PCE or what their favorite part about the PCE was. They both happen to be degree students now in the MPH program, but they know this session is focused on our sort of people applying as non-degree students. So I've asked them to just talk specifically about their experience in the program for clinical effectiveness. And then hopefully they'll stay on and also be willing to answer questions at the end as well. So Shai, I'll turn it to you first and Sarah next.
Thank you, Heather. So yes, I'm gladly talking about the PCE because it was a very pivotal point in my career and professional life. I'm a leukemia physician, originally from Israel. I came here almost 3 years ago, and I started an advanced clinical fellowship at Dana-Farber. And I heard about this program from colleagues, and I was recommended to do so, and I'm very happy I did because it really changed the aspect of the 2 years I did as an advanced fellow, mainly because it gave me the tools to do a lot of research. As Heather discussed earlier, there is a project you're doing. I did a project and I was able to publish it in a prestigious paper in my field as a manuscript, and it also gave me the possibility to do a lot of other researches. And I must say, I'm not a statistician, I'm a clinician, but it gave me a better language to discuss with my statisticians and provide them with a better, accurate definition of the questions and the data to answer the questions. So we have a mutual join in working together, and also I like statistics, so I also try to do some of it, and I get feedbacks, and I think I said it earlier, and thank you, Brian, and Brian, when he taught me, he said to me, whenever you want in your professional life, you can send a question and I will answer. And he actually did so. I don't know if he remembers, like a year and a half after I finished the course, I sent him some questions about survival analysis and he answered me. So that it was marvelous to know that you can ask someone and get like super professional answers on time, and you can learn from that. So I think it changed my trajectory. Today I'm going to be a faculty at Dana-Farber, and I'm going to be in charge of this association, the leukemia department, between stats and clinical and clinical trials and clinical studies. So I think the program really allowed me to do that, irrespective, even without completing the MPH, which is something I just I decided to complete this year. Just these basics really allows you to do a much more comprehensive understanding and communicating with for better studies and trials, and that's at least my point of view.
Thanks, Shai. That's really great to hear. And I'm not surprised about Brian responding to your questions a year and a half later. So with that, I'm going to turn it over to Sarah next to introduce herself and talk a little bit about her experience in the PCE. Thanks, Sarah.
Thank you, Heather. Hi, everybody. I'm Sarah Justbig. I'm a pediatrician. This spring, I am finishing my fellowship in academic general pediatrics at Boston Children's, as well as my MPH in clinical effectiveness at Harvard Chan. I took the PCE in the summer of 2022, a year into my fellowship, a year into living in Boston. It was one of the best experiences of my fellowship. So as Heather mentioned, I'm thrilled to talk about it. Hope I can shed some light on experiences and happy to answer any questions that you guys have. When I think of favorite aspects of the PCE, two things that come to mind really are the people and the practicality of it. I think I'm going to echo a lot of what our professors and Shai have said. People you have now met, 3 of our amazing faculty members, and as they described, there's this team teaching approach, which is so special. So you learn from so many people, so many content experts. As Fran mentioned, there were also opportunities for office hours with content experts in so many areas, as well as one-on-one chats with statisticians as you were preparing your mini grant proposals. We truly, throughout the summer, were learning from the best experts in the field and people who have become real role models and mentors for us. We also learned so much from each other, as everyone has talked about too. For me, I literally met Boston Children's colleagues who I would not have known otherwise without experiences like the PCE, and I met people from all over the country and all over the world. Some of our international friends then came back this past summer for summer number 2, and it was so wonderful to see them again, and we really had kept in touch. As you can hear from the experiences of the courses and the descriptions of the courses, so much of the work is collaborative, and there's so much we can learn from one another. Also, as Heather was talking about the different workshops and presentations, you learn so much from other people's research projects, as well as the critiques that they receive. And you also develop the skills to be able to critique one another's work, and that makes your research better and your appraisal better. And then into the other areas, just practicality. I was a year into fellowship, as I said, when I took the PCE. I had started research in early child development, which has since been grant funded. And I think a big part of that is all of the feedback that I got in PCE and how far I was able to move the project because of everything that I learned in PCE. As Shai was saying, I totally agree that from a statistics perspective, it has allowed me to do a lot of the statistical analysis for my work on my own because of how practical and applicable and in the software it was, as well as learning the why behind all of the math. And when I've been lucky enough to be around statisticians on clinical research teams, it's helped me to speak their language and ask much more intelligent questions and be able to think deeper about the project and speak truly their language, thanks to biostats. From an epi perspective, I think learning how to critically analyze the literature. I remember in one of my favorite sessions was a critique of the literature seminar, and there was so much choice that we even got to pick kind of whatever was closest to our field, whatever sort of paper we wanted to be in a group for, and talked through the pros and cons, the good pieces, the bad pieces, what we would change, what we would rate it in different areas. And it was just so useful. The variety of assignments were great. As our professors talked about, everything, some were quizzes, some were problem sets, some were papers, some was the grant proposal, some was preparing slides for a workshop or presentation. And everything was just so useful. When I had conversations with mentors back at Boston Children's, both during that summer and after, they were floored by the depth and quality of feedback that I had gotten on my project. And that really has transformed the way I've thought about research since. I also loved the electives, and that sometimes was a way to sort of shift your brain from a very math and epi kind of thing, where more debates and papers and other sorts of things. And I think we realized how different people's approaches from different aspects of healthcare and their jobs really informed the quality of discussions that you could have in class. I'm lucky that PCE is a part of my fellowship, and it's also now been wonderful to see co-fellows in years after me take the PCE and have such wonderful experiences, and to sort of bond over that and to talk through classes together, and to all have this shared experience that we bring that really has made our skills in clinical research and as clinicians so much stronger.
Thank you, Sarah. There's a lot. There was like just to let everybody knows, like I do not pay Sarah or Shai to say these things. I did not give them a script, but it's great to hear the enthusiasm and how the experience was. So, so Sarah and Shai, I hope you'll stay on for in case there's any questions for you at the end. So with that, Fran, we will turn it back to you.
Okay, I'm gonna show you my bragging slide. You know, there are other certificate programs to learn the skills to do clinical research. I mean, not only at Harvard, but throughout the country, throughout the world. Even at Harvard, there are at least 3 others, one by the medical school, another one online from the School of Public Health, and the Harvard Catalyst, a Harvard-wide grant has a certificate program that Brian's involved in. What makes ours different? Maybe this is, first of all, is the history. We've been at this a lot longer than others. As I said, 37 years. We have a very condensed schedule. One of the people who developed this program, Lee Goldman, back in 1987, said our job is to, you know, push you to the edge, but not push you over the edge. He would jokingly say, yes, you can go to the beach on the weekends, but bring your stat book with you or something like that. So we try to give you as much as we can to fit into these 6 weeks, to the various skills that we try to offer. And we try to give you ways to build on those if you want. I mentioned our targeted degree programs. We have, our courses are highly rated. You know, we'll talk more about the ratings of courses. Later in the spring, we have an information session to help people choose their elective courses. I mean, especially our morning courses and most of our afternoon courses are one of the most highly rated courses at the School of Public Health. The possibility to take the tuition and the credits you've earned from this program and apply it to a degree at Harvard, if accepted into that degree, is special for this program. That doesn't hold for the other certificate programs, I think, at Harvard. You know, it is a good first step if you want to go on for a degree. But as I said, that what makes our course so special is not the faculty, they're great teachers, but I think the fellow students that you'll meet and learn with as you take the program. So that's my pitch for taking the program in clinical effectiveness. Before we open it up for questions, Marion, you want to say a little bit about the application itself?
Sure, I'd be happy to. So the degree deadline for applications is February 1st. We ask you to, the website is right here, it's hyperlinked through the non-degree application site. You are needing to put your CV up, you need a personal statement, and just to let you know, we've gotten a bunch of questions if the Harvard or the HMS, there's a certain CV that is very specific, if that is acceptable, and it is. The format is not as important on that. We need a personal statement from you. You are needing to supply us with 3 evaluation letters, and transcripts are optional, standardized tests are optional. We do not require those. The other part we do require is the PCE application supplement, which is a separate link on that same website that we ask you to quickly fill out. It's a very brief 5-minute questionnaire, and we hope to get your applications in by February 1st. Do the next slide. If you have any questions, you can always reach us under proclineffect@partners.org. We usually answer within 24 hours. There's some questions that we direct you to the admissions office at the School of Harvard Chan, just because it's you know, a little bit like visa questions, things like that. I will always involve the admissions team, so you can also feel free to reach out to them directly at admissions@hsph.harvard.edu.
Okay. So we're going to open up for questions in a minute. And you can ask questions by just There's a way to raise a hand on Zoom. You can type into a chat room. You can just speak up. There's a small enough number of us tonight if you have any questions. Since this is being recorded, I have a few other slides for questions we frequently get over the years. I just want to answer those before I answer yours. Maybe yours will be these. So often we get a question, is it possible to enroll only in the epidemiology course in the morning, but not in the biostatistics class? So only enroll in the biostatistics class, but not in the epidemiology class? And the answer is no. These two courses have to be taken as a package. They're integrated. They build on one another. So you cannot enroll with one without the other. There's another summer program at Harvard called the Summer Session for Public Health Studies. They have an introductory course in epidemiology and an introductory course in biostatistics. They're good courses, and you can take one without the other, but they're not for example, the epidemiology course doesn't have that project building exercise as part of it that our course does. So our courses have to be taken as a package. Another question is, can you only take the morning courses, Epi and Biostat? Do you have to take an afternoon class? And again, no, you cannot just take the morning class. These classes are only open to students in the program in clinical effectiveness. And students in the program in clinical effectiveness are required to take 15 credits. That means they have to take the morning courses in epidemiology and biostatistics and an afternoon elective course in the first half of the summer 1 period, and a different afternoon elective course in the second half of the summer 2 period. Now, I mentioned that we offer these advanced courses for returning students. And the question is, can I replace the morning core courses, the EPI 208 and the Biostat 206 and 207, with the advanced courses? Yes, if you've had courses in the past like those that we offer, you could take our advanced courses and essentially pass out of the introductory courses. But they have to be similar in content. And as Heather mentioned, her course will talk about propensity scores and causal inference and causal diagrams and other things. Chances are you didn't get that in an epidemiology course you might have taken in medical school. And Brian's getting into different types of regression models at the end of his courses. Chances are that's not the biostat course you took in medical school. But we've had every year a couple of people with previous Masters of Science degrees or previous MPHs from different places, and they've taken a number of epidemiology and biostatistics courses, and we've allowed them to take our advanced courses in place of the core morning courses. But these are exceptions, 1 or 2 a year. You still have to take 15 credits. So as I said, there are basically 2 ways to get a certificate for the program in clinical effectiveness. You could take the core courses and an elective course in summer 1 and an elective course in summer 2, or you can, in place of the core courses, take the advanced courses and still take an elective course in summer 1. There's a type summer 1 and 2 elective courses in summer 2 to get to the 15 credits. Another question we get in the past, are these lectures recorded? I mean, life happens in the summer. Kids get sick and you might have to miss the class, or you might have to do a clinical rotation at a certain time or something. We try to ask people to clear their deck from clinical responsibilities, but that's not always possible for students. And there might be days when you're going to have to miss a class. And are the lectures recorded? Well, Heather and Brian record their classes. We strongly recommend you come to class. You just don't watch the recordings on your own schedule. These courses are not built to be an online courses, but they do give you the flexibility. They do record the lectures. Now, what about the other courses, the afternoon elective courses, the advanced courses? Well, it's really up to the faculty member. And you'd have, later on, if you enroll in this program and have questions about that, we can connect you with the faculty member. You can ask, are your lectures recorded? The last question is there an online option for this PCE in 2024? And the answer is no. We've had online options the last couple of years. The school decided this year that this would not be something they want us to do. So for 2024, there is not an online option. You have to be essentially here. There are lectures being recorded in the morning, give you some flexibility, but none of our classes are meant to be taken online. They're not designed as online courses. I've designed online courses, as many of our faculty have. but this is designed to be something you take in person. So that's the last of my frequently asked questions. I'm going to stop sharing. And I'm going to now open it up to any individual questions that you might have. So again, you can raise your hand, you can type in a chat, or you can just speak up. There are 16 of us here right now, and roughly half of them are faculty, administrative, and graduates of our program. But the other 8 or so, if you have any questions, this is an opportunity to bring them up. You can always send it to us by email. If you have questions, we'll try to respond that way. But I'm going to shut up and ask if there are any questions. And it's sound of silence. Okay.
I have a question for the graduates of the course. I was wondering about the elective courses and how you went about choosing which elective you did and what the highlights of that elective were.
Do you hear me well?
Yes.
Okay.
Yeah.
Okay, great. I'll start. I read about the curriculum of the courses, and I asked actually people who've done the course, I mean the program in the past, what's their opinion and how much work each course takes, because it varies a lot. I did 2 courses, one of them because I'm interested in regression and stats. I did one course I took the linear and longitudinal regression course, which was great. And the other one for me was the decision analysis, which is not my forte usually, but I wanted to experience something else, and it was also very enlightening. This is not usually the kind of research that I'm doing, but it definitely helps me even by reading paper, critique it more accurately, and understand things that are not my day-to-day. So both my electives were really phenomenal.
Yes. Similar experience with phenomenal electives. The one that I took in the first summer isn't one of the ones offered in summer 1 this coming summer, but in summer 2, I took the quality improvement course. That was excellent. I learned about the electives from the course descriptions online and from fellows ahead of me who had taken them, and all of them really had come highly recommended. For me, one of the big reasons I picked the QI one was because I thought maybe I would like to do a QI project as a fellow, and I didn't feel like I had the background to be able to really know where to start. So I loved that particular elective really gave those fundamentals in QI, things like what's a run chart, what's a shift. And it also was sort of like a leadership course. So it was a little bit of both. One of the assignments was doing a QI project for yourself. You had to set a wellness goal for the summer and then track how often you were sticking to your goal and make run charts out of it, which was a really fun way to learn a practical skill. And then another one of the assignments was interviewing someone in your life who's been on the patient side and learning about advocacy and the importance of advocacy in healthcare by learning a patient story from their lens. And it had a lot of great guest speakers, some of whom came in person, some of whom Zoomed from all over the world, to really leaders in medical leadership. We took a field trip to the IHI Boston office, the Institute for Healthcare Improvement, and it was wonderful. But have heard great things about all of them. And it was just cool that there was a lot of flexibility, that if there's a particular skill set that you're hoping to get, it's probably here.
Great, thank you.
I just want to add that back in 1987, when the program started, we had one elective course in the summer 1 period and one elective course in the summer 2 period. Everyone had to take the same course. I think one of them was health policy, the other was decision analysis. The afternoon electives are intended to take your skill training one step further by specializing in an area. And what we've done over the years, we've asked students on the last day of the summer, if we're going to add an afternoon elective class, what should it be? So the ones that we offer this year are basically, who can take the blame for it or the credits? Probably the previous students. They said, these are courses we'd like to have as options for our afternoon electives. We have 5, in summer 1 and 5 courses in summer 2. Some years we've had 6. but this year we'll be doing the 5, and they're chosen because they're pertinent for people who want to do clinical research, and so even if you don't see a course that seems to be relevant for your field, as was mentioned by Shai, for example, the decision analysis course. Every year we get some people who take that course and get turned on to the field as saying, gee, this is something I hadn't thought about before, and this is what I want to do in the future. So, I mean, take advantage of these courses, and if there's not one that is definitely a good fit for you right now, take one that might expand your horizons. So, but everyone has to take one afternoon elective, and some are one afternoon elective, and some are 2. Other questions or comments?
Hi,
Hello.
I just have a question in regards to the letters of recommendation for the application.
Mhm.
I saw that the recommender should comment on your clinical ability and or research potential. Is there any requirement as to whether this person has to be a supervisor, have worked with you in the same institution, or maybe a research mentor, even from a different institution? Any advice on that?
Well, I would say, first of all, if you're fortunate to have a current research mentor, we'd love to hear it from that person. I mean, they're the best ones that can talk to us about the fit of this program with what you plan to do in the future. Not everybody has the benefit of having a research mentor when they take the PCE. Many people are just joining a fellowship program. This is their opening day. They join on July 1st, and here it is, July 6th or something like that, and classes are beginning. Yeah, in that case, we'd like to hear people who they have been involved with their training in the past. What we're looking for are people who have the potential to do, clinical research. And that means they have an environment that fosters, mentoring, and will take a person beyond what we can do in the summer. We try to say you go hit the ground running at the end of the program in clinical effectiveness to start doing the research. And it's great if you have an environment where you can actually apply what you've learned, immediately into that program. So, for example, we don't take, junior residents or senior residents, even if they have 1 month off or 2 months off to do clinical research, because they're not going to be able to use these skills until sometime in the future when they're in a fellowship program. So yeah, we take residents like surgical residents who have a year protected time to do research, but not medical residents who might only have a month. This is not the time they should be taking this program. They should be taking it close to the time where they'll be applying the skills to actual research questions that they're interested in. So going back to the 3 letters, yeah, I mean, it's great if you have people who say you're working with them now, but if you don't, people who you've worked with in the past, it would be more than sufficient for that. And I would say pretty much anybody you've known since in your clinical training or even medical school might be appropriate if you've been involved in research as a medical student.
Great, thank you very much.
Other questions, comments?
I have a practical question about the letters of recommendation. So I saw that you go on the SOPAS website and it sends them an email. One of my letter writers was wondering if it's a letter that he should send or if it's specific questions that need to be addressed in the form.
It's a free form letter. We'd like to hear what they think about you, and there's no specific questions that we're looking for and having to answer. Yeah. Other questions? Other comments from faculty, graduates, before we call it for me, an afternoon, for you guys, an evening, maybe for some of you, a morning. I don't know where everybody is right now.
I would just maybe add that once you get into this great program, try on these 6 weeks to really focus on the program, because it's a really as Fran said, on the edge. And really, if you want to learn it, you really need to dive into it and do everything in your own hands and all the programming. And I had no background in programming whatsoever, so I need to learn it. And it wasn't difficult, but it just takes time, and you need to have this time during these 6 weeks. So I think that's very important during that time.
Yeah, I've been asked the question by colleagues at the School of Public Health in the past. I mean, how can you teach anybody for 6 weeks, all day, 5 days a week? I mean, it's just, how can they soak it all in? And, I'm not a clinician, so I was never an intern or a medical student. But what I've heard is when you guys were in medical school, you could work 24 hours a day if you wanted to in terms of readings and preparation for classes. An intern, you were in the hospitals for more than 40 hours a week. So time management is something that our students are very familiar with. And so we ask people at the end of the summer for every course, how much time did you spend on the courses and things like that. I don't think I've ever got, maybe a few people have commented at the end of the summer, of the 4,000 people we've had, that the workload was too great. It was just unmanageable. But we don't get those complaints from people. Yeah, it's a lot of work, but it's an opportunity, as Shai was saying, to really learn some skills in a very condensed period that you might have to take a semester of school and a graduate program to learn. You can learn them in 6 weeks. So it's a testament to the teachers that we have and the students that we have. Okay, broken record. Any other questions? Okay. Marion, are you still with me?
Hi.
There you are. Marion, go ahead, Andre. Okay.
I'm sorry. You mentioned that there are specific skill sets that are acquired on programming. I didn't quite get the software that you guys use over there.
Brian, you want to repeat it? I can pull up the slide again, but you can just say.
No, you don't have to. We support 3 different software packages: SAS, Stata, and R. So you can use any of those 3.
Oh, okay, great.
Yeah.
Okay. Marion, you want to call it a night?
I think we can call it a night if there's no other questions. We thank you all very much for joining us tonight, and all the faculty and students talking so greatly about the program. As mentioned, we will be putting this recording on the website so that anybody who was not able to join tonight still has an opportunity to get all these questions answered. And if no one else has anything to say, then I'd say have a wonderful night.
Great, guys.
Thank you, everybody.
Thanks
Take
for
care.
attending.
Hi,
Bye,
thank you.
everybody.
Bye-bye.
Oh,
Thank you.
actually, can I still ask something? I'm sorry.
Yeah.
Can you
Yeah.
hear me?